Thank you very much for the opportunity to testify before you today. My name is Beau Kilmer, and I'm a senior policy researcher at the RAND Corporation, where I also co-direct our Drug Policy Research Center. RAND is a nonprofit, nonpartisan research organization that does not have a formal position on cannabis policy, and we do not advocate for or against legislative bills or ballot initiatives. I've researched cannabis policy and the economics of cannabis for more than 15 years, and have spent a lot of time working with jurisdictions that are considering or who have recently implemented cannabis legalization. For example, soon after Washington State legalized, I led the effort to help them understand what the size of their market was so they could make decisions about the number of stores to allow and make more accurate tax projections. And when the state of Vermont wanted an analysis of the pros and cons of various decisions surrounding legalization, I led that team as well. I spent time in Uruguay before they legalized and was there after it passed to help them think through the issues surrounding how you evaluate this large policy change. I look forward to answering your questions you may have about these jurisdictions, especially when it comes to regulating cannabis potency. In the U.S., states have put limits on the THC levels in edibles, but I'm not aware of any states that have put THC caps on flower or on concentrates. Now, in contrast, Uruguay does not allow edibles or concentrates to be sold in the pharmacies and has limited sales to about 4 different varieties of flower with a maximum THC level of 9%. Since I know this is a topic of discussion here in Canada, I'd like to offer 4 observations. First, we know very little about the health consequences, both the benefits and the risks, of many of the cannabis products now sold in medical and non-medical markets. Indeed, most of the health studies that get quoted in legalization debates are based on individuals who were smoking lower potency cannabis in the 1980s and the 1990s. Things have changed. In the work that I've been doing for Washington State, where we've been analyzing tens of millions of transactions, we know that for all the flower sales, the average THC content is now reported to be over 20%. There's a very small but growing literature on the health consequences of consuming higher potency cannabis flower. A review in the Lancet Psychiatry identified a handful of studies that found higher potency cannabis to be associated with negative mental health outcomes. However, the authors noted that most of these studies did not actually measure THC and CBD directly and instead had to use indirect measures that were far from ideal. The authors also found evidence that CBD may attenuate some of the effects of THC, but argued that more evidence is needed before we can really come to strong conclusions about what would be the appropriate THC to CBD ratio. Now, even less is known about the health consequences of dabbing, which involves flash vaporization of concentrated cannabis, which can exceed 75% THC. A scoping review published in February of 2018 concluded that there is still a paucity of rigorous and high-quality data on health outcomes from various cannabis routes of administration, but they did note that there have been some case studies suggesting that dabbing can lead to acute harm such as psychotic episodes and severe impairment, which may increase injury risks. Now, vaporizing flower product and cannabis concentrate in e-cigarette type devices has a distinct advantage over burning flower, and that smoke contains higher levels of carbon monoxide and other harmful substances. That does not mean that the act of vaporization is without risks. Much depends on the chemical used to facilitate the vaporization or to create the concentrates, and it's also going to depend on the pesticides used to grow the plant. Now, the second point I'd like to make is that we know very little about the extent to which users are titrating their THC consumption. While potency is increasing, that does not necessarily mean that all users are getting more intoxicated. For example, if a user typically used to smoke a whole joint that was 5% THC, well, if the THC content is now 15%, are they only consuming a third of that? That is, titrating their THC consumption. Unfortunately, the scientific literature on THC titration is very small. In fact, I'm not aware of any studies that have looked at this, either in Canada or in the United States. The third point I want to make is that, one option jurisdictions have, especially those who are for cautious policymakers, is to temporarily ban certain cannabis products or impose a potency cap on some products until more is known about their health effects. But of course, if certain products are unavailable in the legal market, some users may look for them in the illicit market or try to produce them. Others may not. Much will depend on the size of the illicit market after legalization, which will not only be shaped by competition with the medical and the non-medical markets, but also by the amount of enforcement pressure applied to those participating in the illicit market. In jurisdictions that are aggressive about minimizing the size of the illicit market, the law enforcement costs associated with cannabis could actually increase in the short run after legalization. But I want to make it clear with legalization, the illicit market is not going to disappear overnight. The question confronting policymakers is how quickly do you want to reduce it? If the only goal is to get rid of the illicit sales as quickly as possible, then policymakers would just flood the market with minimally regulated products till it gets to the point where it would no longer make sense to sell them in the illicit market. But for those who care more about public health, they're likely going to want a well-regulated market that prioritizes accurate testing and labeling, even if this keeps prices higher and slows the decline in the size of the illicit market. Now, understanding where people fall on the spectrum can make for much more productive conversations about cannabis policy. My final point is that jurisdictions could actually nudge users to lower potency cannabis products by charging more per unit of THC for the higher potency products. In jurisdictions with government control over the wholesale or the retail markets, regulators can simply set a higher price per unit of THC for certain products. When price setting is not an option, governments could levy a tax based on THC concentration that increases along with the amount of THC in the product. Remember, the final report of the Task Force on Cannabis Legalization Regulation recommended that Canada, and I quote, develop strategies to encourage consumption of less potent cannabis, including a price and tax scheme based on potency to discourage purchase of high-potency products. Now, in summary, it is common to warn those who are new to using cannabis edibles to start low and go slow to prevent them from over-consuming THC. The question now confronting Canada is whether or not you should adopt a similar start low and go slow approach when it comes to regulating cannabis potency if C-45 were to pass. Cautious policymakers focused on public health have many options when it comes to potency, ranging from temporary bans on certain products to potency caps to price setting to imposing taxes based on THC content. These options all come with advantages and disadvantages that deserve more attention in discussions about cannabis legalization in Canada. With that, I will close, and I look forward to your comments and questions. Thank you.
Thank you very much. And our third speaker.